This is now officially a pandemic. The World Health Organization confirmed today
that COVID-19 can be characterized as a pandemic.
March 11th, 2020, the day a reeling world was ground to a halt. The World Health Organization declared COVID-19 a global pandemic. The world watched in horror as highly resourced health systems capitulated in terror in the face of a vicious virus. Africa's fate hanged in a balance. The continent's leadership did not fold, they did not buckle, they did not fail. Weeks before the official declaration of the pandemic, the African Union announced a joint strategy to deal with the menace. Beyond solidarity, beyond Ubuntu, beyond the courage of leadership and the foresight of hope, Africa was blessed with one more resource: a dynamic community of innovators at home with the new languages of digital technology and creative partnerships. As the continent ramped up testing facilities and quarantine centers, the African Union, through its frontline agency, the Africa CDC, was also quietly assembling its digital warriors. Supported in no small measure by its strategic partners, Afro Champions, ARSO, ASLM, Cold Chain, African Tourism Board, and a host of others. Panabios was born from this rich medium of collaboration, setting the stage for the Africa Union's trusted travel, trusted testing, and trusted vaccines systems. The interlocking effect of all this creativity, all this passion, all this innovation was an African Union whose member states felt bolstered and fortified to begin the reopening and recovery effort on sure footing. So soon it was time to move from dashboards to border posts, time to connect laboratories around the continent to a single unifying interface, time to turn on the lighthouses of medical transparency whilst doubling down on data protection and privacy. Africa was primed to pioneer a new concept of intergovernmental digital health infrastructure that will now long outlast the pandemic, ushering in a new era of digital health cooperation, a veritable new public health order. From digital contact tracing to automatic exposure notification, and from electronic congestion monitoring to digital biosurveillance, the new public health order was now a living, breathing fact of life. At airports around the continent, Africa's pioneering effort was a sight to behold. Smoother health screening and speedier detection of fraud and forgeries that would have undermined the effort to keep the vicious virus at bay. Integrations with other continents commenced in earnest, from as far afield as India, Singapore, and Australia to our nearest neighbors in Europe and the Gulf. To date, more than 10 million Africans have benefited from the Panabios, trusted travel and trusted vaccine services and platforms. And now that the pandemic is on its back foot, now is the time for even more visionary health cooperation. Now is the time to infuse resilience, to bolster the health and vitality of the continent. It is time to consolidate the multiple digital innovations that emerged during the pandemic into a grand trusted health paradigm, a continental hub of interoperable digital health solutions addressing the biggest trends in universal health access, health equity, genomics, and public health decision support. It is time for the new public health order to rise from an ascending Africa, marching forward towards Agenda 2063 in a century rightly nicknamed the African Century. It is time to transcend all pandemics, time to own our century.